Hi class, welcome to the Care of the Child with a Respiratory Disease. This course, Care of the Child with Respiratory Disease, will be part of the BSN nursing program offered to students in the junior year of the spring semester. This unit of instruction will focus on the respiratory diseases experienced by the pediatric patient. There are many respiratory diseases that the pediatric patient will experience. These include the following: Croup, acute bronchiolitis, respiratory syncytial virus or RSV, bacterial pneumonia, cystic fibrosis, and asthma. The first disease that we're going to talk about is croup. Croup occurs in younger children anywhere from 6 months to 3 years, and it's an infection of the airway which obstructs breathing and causes a characteristic barking cough. This cough is the result of swelling around the voice box, the larynx, the windpipe, and the bronchial tubes. When a cough forces air through this narrow passageway, the swollen vocal cords produce a noise similar to barking, to a seal barking. Taking a breath produces a high-pitched whistling sound. Some symptoms that the child with croup experiences are upper respiratory symptoms for 1 to 3 days, low-grade fever, barking cough, hoarseness, inspiratory stridor, a cough that's worse at night. The child prefers to sit up because it's easier to breathe, and is aggravated by agitation and crying. If the child's symptoms last longer than 3 to 5 days without responding to home treatment, parents are urged to call the pediatrician. Also, the parent should call the pediatrician if the child is exhibiting the following symptoms. 1. If the child is making noisy, high-pitched breathing sounds when inhaling and exhaling. If the child is making high-pitched breathing sounds when they're not crying or agitated. Drooling or difficulty swallowing. If the child is increasingly anxious, agitated, fatigued, and listless. If the child is struggling to breathe. If the child is developing blue or grayish skin around the nose, the mouth, or the fingernails. The prevention of croup is frequent hand washing and staying away from other children or adults who are sick. The treatment of croup is comfort, steroids, and epinephrine to decrease inflamed airway, keeping the child calm, cool air mists, and fluids. The next disease we're going to talk about is respiratory syncytial virus. Respiratory syncytial virus causes mild cold-like symptoms in older children and can cause serious problems in young babies, including pneumonia. Some symptoms of respiratory syncytial virus or RSV is fever, stuffy nose, cough, trouble breathing, listlessness, irritability, poor appetite, and apnea. The pathogenesis of RSV is a virus, and it causes an increased and intense inflammatory response. Some additional RSV symptoms in babies is babies refusing to bottle feed or breastfeed, babies that are unusually upset or inactive, babies who have trouble breathing or shortness of breath, and producing of cough of yellow, green, or gray mucus. How do you prevent RSV? Is washing your hands, keeping toys, clothes, blanket, and sheets clean, staying to yourself or avoiding young children during RSV season or adults with a cold, and no smoking. Treatment of RSV is usually supportive fluids, oxygen, antipyretics. There's usually no antibiotics, no steroids, or bronchodilators. The next illness that we're going to talk about is bronchiolitis. Bronchiolitis is a disorder most commonly caused in infants by a viral lower respiratory tract infection. The most common lower respiratory infection in children from 1 month to 2 years of age. Most cases occur in children in the winter and early spring, and bronchiolitis is caused by a viral infection that is characterized by acute inflammation, edema, and necrosis of epithelial cells lining the small airways, increased mucus production, and bronchospasm. In bronchiolitis, the bronchi and the bronchioles become plugged with thick viscid mucus, causing air to be trapped in the lungs. The child can breathe air in, but has difficulty expelling it, which hinders gas exchange. Some symptoms of bronchiolitis are runny nose, congestion, cough, low-grade fever, difficulty breathing, wheezing, and otitis media. This is just an overview of the pathophysiology of bronchiolitis. The treatment of bronchiolitis is high humidity using a mist rest, increased fluids, O2 via face mask or oxyhood, and blood gases if needed. Bacterial pneumonia is an inflammation of the lungs caused by bacterial viruses or chemical irritants, and is a serious inflammation in which the air sacs fill with pus or other liquid. Bacterial pneumonia is caused by various bacteria, Streptococcus A, Group B Streptococcus, and Staphylococcus aureus, and amongst other bacteria also, which you can see here. The symptoms of pneumonia are shaking, chills, bluish color of the lips and nose, dizziness, headaches, stomach pain, loss of appetite, fever, cough, vomiting, and diarrhea. Diagnosis of pneumonia is made by chest x-ray, physical exam, blood tests, sputum culture, pulse oximetry, chest CT, and bronchoscopy. The treatment of pneumonia is antibiotics, increased fluid intake, cool mist humidifier, Tylenol for fever, cough medications, and nebulizer treatment. Cystic fibrosis is the most common and serious genetic disease in Caucasians and is a chronic condition that affects the lungs and the digestive system of the body. Children with cystic fibrosis may have chronic lung infections or poor digestion of their foods. 1 in 25 Caucasians is a carrier. Cystic fibrosis, the symptoms first appear in early childhood, and as I said, it affects the lungs and the digestive system. In cystic fibrosis, thick mucus collects in the lungs and causes repeated coughing, wheezing, and attacks of bronchitis and pneumonia. In later years, the individual usually has increasing shortness of breath and fatigue. Diagnosis of cystic fibrosis is through a sweat test. A sweat test occurs that a mild electrical current pushes medication into the skin to cause sweating. Sweat is collected and the salt content is measured. Cystic fibrosis becomes present when there's a defective gene related to a protein that is involved in chloride ion transport. Patients with the diseases usually, as I said, develop unusually thick, sticky mucus, thick mucus plugging that clogs the lungs and causes obstruction, which leads to life-threatening lung infections and also obstruction in the pancreas. Some symptoms of cystic fibrosis are persistent cough with productive thick mucus, wheezing and shortness of breath, frequent chest infections, sinusitis, nasal polyps, bowel disturbances, weight loss, obstruction, and constipation. Usually children who are diagnosed with cystic fibrosis are very low on the growth scale, and their weight is usually low compared to other children their age. The treatment of cystic fibrosis increased calorie, increased protein diet, chest physiotherapy, postural drainage, breathing exercises, and aerosol therapy. Also, antibiotics, supplemental vitamins, pancreatic enzymes are also a part of their daily routine. And this is just an overview of cystic fibrosis that shows you the causes and the risk, the symptoms. And our last disease that we're going to talk about is asthma. Asthma is a spasm of the bronchial tubes caused by hypersensitivity of the airways in the bronchial system and inflammation that leads to mucosal edema. Asthma is also referred to as reactive airway disease. Asthma attacks are triggered by hypersensitivity response to allergens. Asthma triggers include allergens, chemical sensitizers, air pollutants, virus infections, exercise, cold air, and emotions. Some asthma triggers are respiratory infection or stress, cold exposures, obesity, dust, pets, drugs, household chemicals, exercise. Some symptoms of asthma are difficulty breathing or shortness of breath, chronic cough, sleeplessness, wheezing, chest pain, cough after exercise. And these are just giving you some pictures of some other causes of asthma. The treatment of asthma is bronchodilators, eliminating allergens, corticosteroids, nebulizer treatments, and chest PT. This concludes my overview of the child with a respiratory disease.